In every OSCE examination run, there'll be a total of 3 stations testing the ability of candidates to either communicate with a patient or take a patient history. The Communication Station is a test of communication skills in a number of common anaesthetic and critical care scenarios. It is important to remember that communication is a two-way process of collecting and giving information. The aim is not to take a history. When entering the station, the examiner will check your candidate number. Interaction with the examiner is minimal in this station, as the interaction should be with the patient, with the examiner observing. The scenarios utilise an actor, occasionally 2, to play the part of the patient, so that the interaction is consistent for all candidates in the OSCE run. A total of 20 marks are available. Marks are awarded for information gathered and for qualitative aspects of the interaction.
This is Mrs. Dalton.
Good morning, Mrs. Dalton.
Hi.
My name is Dr. Smith. I'm one of the anaesthetic core trainees. I'm one of the anaesthetic team that will be looking after you this afternoon on the emergency list. I was wondering if we can just start by, if you give me your full name, your date of birth, and just what it is you're expecting to have a bit later on the emergency list.
Yes, hello Dr. Smith. My name is Elizabeth Dalton and it's 26th of May 1976. I'm expecting to have an examination of my tummy. I think it's a laparoscopy, they said.
Nearly everyone mentions their name and checks the patient these days, but strong candidates explain their role in the anaesthetic team and discuss the purpose of the visit. For example, routine assessment, to answer specific questions, etc.
Well, I've had this bad lower tummy pain and I'm late with my period. I've had a few other investigations and the doctors said it might be a good idea to rule out anything serious.
Okay, no problems. Well, I've come today just to explain a little bit about what to expect from the anaesthetic you'll have today. I see that you're obviously anxious. That's understandable in the circumstance. Is there anything particularly you want me to discuss with you or factor into the discussion that we have so that I can help alleviate some of those concerns?
Yeah, well, there's a few things actually that I want to talk about, if that's okay.
Sure.
This candidate is asking some open questions to allow the patient to raise concerns.
The doctors mentioned that I might have an ectopic pregnancy. My sister had something similar and ended up coming into hospital pretty unwell. She needed a really big blood transfusion and ended up in intensive care.
Oh, okay, I'm really sorry about that. That does sound very, very bad. Is she okay now?
Yes, she's doing okay now, thank you. They didn't do any further tests or anything.
Okay, and you said at the beginning there that there was a couple of other things. Was there anything else on your mind particularly?
Well, yes, there's a few other things.
Good candidates will listen to what the patient says and follow up verbal and non-verbal clues to elicit further worries or concerns.
Well, my husband and I have been trying for a baby for some time now, and if it is an ectopic pregnancy, the doctors said that maybe they'd have to take one of my tubes out, and I'm worried this might affect my chances of ever having a baby.
Okay, well, listen, I can totally understand why that would be of concern to you at the moment. Obviously, I'm one of the anaesthetic team. I'm not the part of the surgical team, so I'm not best placed to answer that question for you, but I'll absolutely ensure that the surgeons come and see you before we send you down to theatre to have the operation so that they can alleviate any fears you may have. Just before we continue, can I just ask how long was your sister on intensive care for?
I think she was admitted for about 24 hours.
Occasionally, it may be entirely appropriate to ask direct questions to elicit further relevant information, but generally, there should be more open questions than closed. The quick question at the end demonstrates a natural, empathetic tone to the conversation.
So I'm just going to explain a little bit about what to expect from the anaesthetic this afternoon. When you come down to theatre, the first thing we'll do is we'll lie you onto the trolley in the anaesthetic room. I will then place a small tube into the back of your hand. It's called a cannula, and that's put in using a needle. Once that's in place, it'll enable us to give you some medications through the line that will get you off to sleep. Before we do that, you'll have an assistant with me, and they will place some monitors onto your chest to monitor your heart rate and your blood pressure, and then we will get you off to sleep with those medications. And we'll take very good care of you while you're asleep, and until the end of the operation. Is it clear so far?
Yeah, that all seems fine, thank you.
Descriptions should be understandable to the patient and avoid medical jargon. If medical jargon is used, it should be explained.
So just going back to the point you mentioned earlier about your concerns about the pregnancy in the future. As I said, I'm not best placed to answer that question, but I'm going to go away and ensure that the gynecology team come back and speak to you about it before we send you down to have the operation done. Before I go and speak to them, is there anything else that I can go through with you, or any other concerns that you might have?
No, that all seems fine. You've been very helpful indeed, thank you.
Okay, no problems.
It's perfectly acceptable to refer to other team members if the question is not specific to anaesthetics. Borderline or underperforming candidates often answer questions they do not have sufficient experience to answer. Strong candidates summarise and ensure that the patient has understood the nature of the conversation and has no further questions.
Hello there, come and take a seat. This is Mrs. Dalton.
Hi, Mrs. Dalton.
Hello, yes.
I'm the anaesthetist. I understand you're having a laparoscopy done this afternoon because you've got some abdominal pain.
Yes, that's right. Sorry, I missed your name.
The candidate forgets to introduce himself and, by encroaching on the patient's personal space, may not place her at ease.
I'm Dr. Smith, sorry. So I understand you're a bit anxious, and I've come down just to make sure that we can calm you down a little bit. It's totally understandable that you'd be anxious with this type of operation, but you know, it's all going to be fine. Have you got any particular concerns?
Well, I've never had an operation before, so I'm a little bit kind of worried about.
I totally understand. Listen, general anaesthetics now are very safe. We use great induction and maintenance drugs. We can avoid a lot of the side effects which we used to get. So, listen, you should be reassured. It's all going to be fine. Anyway, you're fit and well, aren't you?
I think so, yeah.
The candidate offers limited acknowledgement of the patient's views and, by using medical jargon, may confuse the patient and make them more anxious.
Well, perhaps if I start by just going through what's going to happen now. So we've got a few things to do before we take you down to theatre. There's always the risk of major blood loss, which we need to think about.
Major blood loss?
Oh well. So with an ectopic, it's always possible it could rupture, and you may need to have a transfusion given. So we'll take a cross match.
Well, rupture, I mean, that sounds serious, doesn't it?
The information which the candidate gives is important, but contains more jargon and is rushed, with minimal opportunity for the patient to seek clarification and understand fully what is being said. There is limited acknowledgement of the feelings of the patient.
So you'll come up to theatre a bit later. I'll pop you up onto the trolley. I will pop a drip in the back of your hand.
Sorry, a drip?
Oh, so a drip's a little tube that we put in, so it enables us to give you some drugs through it. It'll be fine. Then my ODP will put some monitors on you, and we'll give you some medication, some white medication that will get you off to sleep. Oh, and I should say that there's a risk you might be sick just before the anaesthetic. So what will happen? My ODP will put a bit of pressure on the front of your throat.
Doctor, when you say ODP, I'm not sure what you mean.
Oh, okay.
The information is delivered in a rushed manner, and the use of medical terms and abbreviations may confuse the patient.
So it's a standard technique. When you're in theatre, we'll get you off to sleep using some medications. We'll put you onto a ventilator, which controls your breathing and will keep a very close eye on your lungs and your heart, and obviously keeping an eye on your blood loss. Then we'll be thinking about analgesia. We use a multimodal analgesic technique, so we'll be using paracetamol, non-steroidals, opiates to make sure you're in no pain. There's a chance, I guess, that the surgeons may need to open you up, and in that circumstance we would put you on something called PCA afterwards. It's called patient-controlled analgesia. It just works much better controlling your pain relief with morphine.
That sounds okay, I suppose.
Oh, good then.
There is little use of open questions on the part of the candidate to seek clarification that the patient understands what has been said. Whilst the candidate offers an explanation of the forthcoming general anaesthetic, there is limited eye contact and a sense of natural empathy so that the patient appears unsure after the discussion. It's not uncommon for the station to finish before the allocated 5 minutes. Once the examiner has finished questioning you, you will not be permitted to go back to something you think you may have missed. The examiner cannot comment on a candidate's performance or on any other details of the scenario. If you feel that you have not performed as well as you would have liked, remember that there are no killer stations in the OSCE, and no candidate passes every station. Once you have finished a particular station, try not to dwell on it. Put it out of your mind and move on to the next station.